Turning 65 is supposed to feel like a milestone. For most Americans, it means retirement is finally getting closer. And the moment that birthday arrives, everyone starts saying the same thing. Sign up for Medicare immediately. Your friends say it. Your coworkers say it. Even some HR departments say it. But what if blindly enrolling in Medicare at 65 could actually cost you thousands of dollars in unnecessary premiums, or even trigger lifetime penalties if you make the wrong move later? Because here's the truth most people never hear. Medicare is not simple, and one wrong decision at 65 can follow you for the rest of your retirement. Today, I'm going to show you the 3 biggest Medicare traps Americans fall into at 65 and how to avoid them before they become expensive mistakes. Quick reminder, I'm a financial educator, not your personal advisor. Always run your own numbers and speak with a qualified professional about your situation. Most people assume Medicare works like Social Security. You hit a certain age, and everything automatically happens for you. But that's not always true. If you're already collecting Social Security before turning 65, you'll usually be automatically enrolled in Medicare Part A and Part B. But if you're not collecting Social Security yet, enrollment may not happen automatically at all. And this is where many people get blindsided. Because if you miss your enrollment window, Medicare can hit you with late penalties that don't just last a few months. They can last for life. For example, the Medicare Part B penalty increases your premium by 10% for every 12-month period you were eligible but didn't enroll. Not temporarily, every single year. Now imagine someone delays enrollment for 3 years because they thought they were automatically covered. That could mean paying 30% higher premiums for the rest of retirement. And emotionally, this is what frustrates retirees the most. Not the money itself, but realizing they made a permanent mistake because nobody clearly explained the rules. This is probably the most misunderstood Medicare rule in America. A lot of people continue working past 65, and many still have employer health insurance. So naturally, they think, if I already have insurance, I can ignore Medicare. Sometimes that's true. Sometimes it's a disaster. The key issue is whether your employer coverage qualifies as creditable coverage under Medicare rules. If you work for a larger employer, delaying Part B might be completely fine. But if your employer is small, or your coverage doesn't meet Medicare requirements, you could accidentally create a coverage gap or trigger penalties later. And here's the scary part. Many people don't discover the mistake until after they retire. At that point, they may face delayed coverage, higher medical costs, enrollment penalties, stressful paperwork, and confusion during an already emotional life transition. This is why blindly following generic advice can be dangerous. Because Medicare decisions depend heavily on your personal situation, not your neighbors, not your cousins, not some random comment online. A lot of Americans think Medicare means healthcare becomes free at 65. It doesn't. Yes, many people get Part A without paying a premium because they paid Medicare taxes during their working years. But Part B usually comes with monthly premiums. Then there's deductibles, copays, prescription drug plans, Medigap policies, Medicare Advantage costs, and dental and vision gaps. And suddenly, retirement healthcare becomes far more expensive than people expected. Some retirees end up spending hundreds of dollars per month just to maintain decent coverage. And financially, this matters because healthcare inflation doesn't stop during retirement. In fact, healthcare often becomes one of the biggest expenses later in life. The emotional cost here is enormous. Because many retirees spent decades planning for retirement income, but underestimated retirement healthcare entirely. The wealthiest retirees usually don't make rushed decisions. They prepare early. They understand enrollment windows, compare employer coverage carefully, estimate future healthcare costs, review prescription plans annually, and avoid emotional decisions based on fear. And most importantly, they realize retirement is about protecting flexibility, not just maximizing numbers on paper. Because sometimes the smartest financial move is the one that reduces stress, protects your health, and gives you peace of mind later. Now I have to be honest. These strategies don't apply the same way to everyone. If you already receive certain benefits, have special health conditions, work past 65, or rely on specific employer plans, your Medicare decisions may look completely different. That's why understanding your exact situation matters so much. Your retirement is not a spreadsheet. At this stage of life, money matters, but so do peace, health, flexibility, and confidence. And sometimes avoiding one major mistake is more valuable than chasing the perfect financial strategy. The people who enjoy retirement the most are usually not the ones who made every perfect money decision. They're the ones who avoided the costly mistakes that created unnecessary stress later. So before you turn 65, or before you make any Medicare decision, slow down, understand the rules, and make sure the choice actually fits your life. And now I want to hear from you. What's the most confusing part of Medicare or retirement planning for you right now? If you found this helpful, subscribe for more retirement and Social Security breakdowns designed for Americans navigating real retirement decisions.